One of our most recently approved therapies is one that's called Lutetium 177 dotatate. That is a radiolabeled peptide that is given as an IV infusion for 4 doses. And this is really a new class of therapies, really broadly in oncology. And the way that it works is there's a target on the neuroendocrine tumor cell called a somatostatin receptor. And this receptor is the target for a peptide that is like octreotide. And I always use the lock key analogy when I'm describing it. That's why I'm using my hands. But and I describe that to patients in that way. And then the receptor is like the lock, the peptide is like the key, and the peptide drags with it a radioisotope, in this case Lutetium 177. So it's a really targeted form of radiation. Dr. John Strasberg was the PI of that study, and it showed a prolonged progression-free survival and overall survival benefit in patients with midgut neuroendocrine tumors. The FDA approval, however, is for all gastroenteropancreatic NETs, and that was based on adding some retrospective data that included pancreatic NETs.